EHS's aim is to get into as many schools as we possibly can and get kids who might not have the chance otherwise to get outdoors, experience what it's like to get stuck in, get muddy and grow things. And I think that's the aims of the Children's Foundation who are funding this project, is to really give these kids a chance to actually have a lot of fun and to come out of themselves really if they can.
I want you guys to do some soil checks and work out which one of your 3 pots in front of you these blueberries will want to be planted in.
We've done so much research into realising that children who are engaged in something, anything, and especially something where they've been more physical, with more tangible, something they can get their hands into, could then go back into the classroom and write better about it. They'll do more mathematics about it. You know, you can explain history through growing. You can really cover all the curriculum subjects through the garden and getting kids outside and actually thinking about things in a wider environment.
This morning we've been doing maths in the garden. We measured the heights of trees, measured the circumference and divided that by 2.5 to work out how old all the trees were.
Children's Foundation have their own specific aims obviously for this project, and that fits in really well with what we do and our experience that we've got in this field. And we're really looking forward to going through spring and summer and maybe beyond with these kids and see how they fare.
So about this time last year I'd never heard of the Children's Foundation before, but I volunteered along with my daughter to do the Christmas bag pack in Eldon Square and heard a bit more from the girls about the good work that they do. So we talked about the Great North Run and it seemed a good charity to do it through. And I've heard that we've got 86 runners this year, so that's good.
Out of all the charities that I looked at, it was one of the charities that looked at children both in the hospital and outside in the community as well, which I thought was quite important.
It's great because to help children from different backgrounds over the region, made more people aware of it, getting sponsors as well.
Various things they do. I've heard about the clown doctors at the RVI. Seems like a great thing to do for the kids, so yeah, it's a great charity.
We've had children smiling who've never smiled during physio before. We've had children wanting to come and do physio, which is quite a novelty often because it's a bit boring and they don't want to do it, and it's getting them to do things that's uncomfortable and can be painful. So yeah, we've had really good results with it. A lot of our children are in for such a long time and they need quite a lot of intense treatment, and although as physios we're very good at motivating people, children just need that little bit extra. If they're having fun, they'll do a lot more. Children's Foundation have raised all the money to let us do this opportunity. We're very lucky, and it's had a big effect on what we're doing here.
If you were dealing with children with cancer, very premature babies, it's perhaps easier to raise money for that particular one focus. But we know where we're positioned, where we have to work with disadvantaged, disabled children, we're into accident prevention and mental health. These are difficult areas to raise money for, but they're such important areas for the children themselves.